Hi, this is a short introduction to HealthPathways. HealthPathways is an online portal that allows doctors, nurses and allied health clinicians to access local health information for over 500 clinical conditions. HealthPathways particularly benefits GPs and their patients by providing easy-to-use clinical guidelines appropriate to the local services available. Now I'll take you on a step-by-step process to access HealthPathways on your computer. Just Google search Sunshine Coast Health Pathways and click on the top link, and that should bring you into the login page. Put in the username and password that you've been given and then log in to HealthPathways. You might want to save this page to your favourites and also the login details. This takes you to the HealthPathways homepage. This page contains important local health system news, such as public health alerts, new clinical services, and educational events. At the top right, there are some useful buttons that link to external websites, such as the MBS Online, the Health Provider Portal, and the PHN Education Calendar. There's also a direct link to all the specialty department request pages. Request for assessment pages contain all the criteria and required information for GP referrals to the public hospital service. On the left-hand side is the main navigation pane. Click on the plus and minus buttons to expand and collapse the menus under each heading. Clicking on the headings or subheadings will open the relevant pathway. You can still use the left-hand pane to navigate back at any time. Headings and subheadings in light grey font contain pathways that have not yet been localised. Non-localised pages contain the information from the founding HealthPathways site in Canterbury, New Zealand. These pages still contain useful clinical information but have not yet been adapted for the Sunshine Coast. Another way to find information is to use the search box. Let's say you are with a patient who has presented with an ovarian cyst. You think they may need investigation and may even need to see a gynecologist. You search for ovarian cyst and click on the link to the relevant pathway. Each pathway generally follows the same format, with red flags, which are important things to consider, assessment, management, and request, which contains referral information. The information is deliberately condensed into drop-down boxes to allow quick navigation to the information you need. You can expand and collapse relevant sections of the page using the plus and minus buttons. In this example, you think the patient needs to be assessed by a gynecologist. So we click on the non-acute gynecology assessment. In HealthPathways language, an acute assessment occurs within 24 hours and a non-acute assessment is anything greater than this time frame. This takes you to the non-acute gynecology assessment page. It's referral options for the public and private health systems. You decide to use the Sunshine Coast University Hospital Public Service. Here you will find the referral criteria for each condition seen in the gynecology department. It allows GPs to understand how their referrals are triaged into category 1, 2 or 3. Importantly, it also contains required information for referrals to the public service. You will find essential information which must be included for a GP referral to be accepted and additional information that will assist in the triaging. This page also tells you how to send a referral with links to the relevant referral templates and contact details. At the top right-hand corner of every page is a Send Feedback button. We welcome feedback from all HealthPathways users, whether it's because you found a clinical error or a wrong phone number, or any suggestions for new pages.
Hundreds of GPs across Australia and New Zealand are already using Health Pathways to improve their patients' care.